Over 1 billion people are slowly being crushed alive by their own bodies, and most of them have no idea how close they are to the point of no return. I'm your host at The Mystery of Science. If you want more videos like this, hit subscribe and drop a like. It genuinely helps more than you think. Today, we're diving into something that medical textbooks dance around but never say out loud. How much weight can a human body actually take before it gives up? Not slows down, not struggles, gives up. The answer is darker than you expect, and it changes depending on exactly where you are on the scale. So let's start at the beginning. Obesity is not a lifestyle choice. Let's get that out of the way immediately. It's a chronic, complex disease shaped by genetics, hormones, your gut microbiome, your environment, and yes, caloric intake. But reducing it to eat less, move more is like telling someone with a broken leg to just walk it off. To understand what's actually happening inside the body as weight increases, scientists use a tool called BMI, body mass index. You calculate it by taking your weight in pounds, dividing it by your height in inches squared, and multiplying by 703. It's not perfect. It doesn't tell you if that mass is muscle or fat, but it gives us a framework to talk about what happens at each stage. And what happens at each stage is genuinely terrifying. So let's walk through it, stage by stage, pound by pound. It starts quietly, so quietly you almost miss it. 5 pounds, 10, maybe 20. On someone who stands 5 feet 7 inches tall, 20 extra pounds already pushes them into what scientists call overweight, a BMI above 25. At this point, you can still run for a bus. You can still climb stairs without thinking. Life feels mostly normal. But inside your body, something has already shifted. Fat tissue isn't just stored energy sitting there waiting to be burned. It's metabolically active. It releases inflammatory molecules called cytokines, and those cytokines quietly begin attacking your blood vessels, stiffening arteries, and nudging your blood pressure upward. Your pancreas starts working harder to manage blood sugar. Your knees, which already absorb roughly 3 to 5 times your body weight with every step, begin registering more stress. And here's what I want you to think about as we move through this. Your body at this stage is not failing. It's adapting. It's fighting. It's doing everything it can to keep you functional. The question is, how long can it keep that up? Here's something I'm actually curious about, and I want you to drop your answer in the comments. At what point in your life did you first become aware of how weight affects health? Was it something you were taught early, or did it hit you later? I'll be reading through the responses. Now we step into moderate obesity, a BMI between 30 and 35. On our 5'7" person, that's roughly 190 to 210 pounds of pure body weight. And this is where the body stops quietly adapting and starts loudly complaining. Your knees are now absorbing force equivalent to carrying another adult on your back with every single step. The cartilage, that rubbery cushion between your bones, degrades faster than it can regenerate. Chronic joint pain becomes a daily companion. Walking a mile stops feeling like exercise and starts feeling like a test of endurance. But the joints are just the part you can feel. What you can't feel is what's happening in your abdomen. Visceral fat, the kind that wraps around your internal organs, is expanding. Unlike the fat you can pinch on your skin, visceral fat is hormonally aggressive. It floods your bloodstream with inflammatory signals, suppresses your body's ability to use insulin effectively, and begins strangling your liver's normal function. Sleep apnea enters the picture here for most people. While you're unconscious and supposedly resting, your airway collapses repeatedly, sometimes dozens of times per hour. Your brain jolts you awake to breathe. You never reach deep restorative sleep. Your heart, instead of recovering overnight, keeps working, and a heart that never truly rests ages faster than it should. Type 2 diabetes isn't inevitable at this stage, but it's knocking on the door, and hypertension has usually already walked in. The bridge is cracking, but it's still standing. Keep watching, because the next stage is where things get irreversible. Severe obesity, BMI above 35. For our 5'7" reference point, we're now talking 220 to 260 pounds. The word severe is not an exaggeration. Your hips and knees are no longer just stressed, they're breaking down. The cartilage that was degrading in the previous stage has now thinned significantly in many patients, and bone begins grinding against bone. Orthopedic surgeons see this routinely, patients in their 30s and 40s with joints that look like they belong to someone twice their age. Standing for long periods becomes genuinely painful. Climbing stairs requires planning. Getting dressed, something most of us don't think about for even a second, can leave someone breathless and sweating. The diaphragm, which needs to contract and expand freely to fill your lungs, is now being pushed upward by abdominal fat and downward by chest wall weight. Breathing becomes mechanically inefficient. Sleep apnea worsens. Pauses in breathing that stretch beyond 20 seconds. Blood oxygen levels dipping into ranges that would be alarming in any other context. The heart responds by increasing its workload even further. Blood pressure at this stage is rarely controlled by lifestyle alone. Medications become necessary, sometimes multiple. The risk of stroke climbs. The risk of blood clots, particularly dangerous clots called deep vein thromboses, increases because blood pools in legs that move less, carried by vessels under constant pressure. Skin begins to fail in places where it shouldn't. Friction ulcers form in skin folds that stay moist. Fungal infections take hold in areas that never fully dry. These aren't cosmetic issues, they're entry points for systemic infection. And this is the part that most people don't grasp until they're there. It becomes a cycle with no obvious exit. Moving hurts, so you move less. Moving less accelerates every single complication we just described. The trap closes. But what happens when someone is still gaining weight beyond this point? Because it gets worse, much worse, and you need to hear this. Extreme obesity, BMI above 40, 270 pounds and beyond on our same 5'7" frame. At this stage, the human body is operating in a regime it was never engineered to handle. The skeleton, built over millions of years of evolution to support a body in a specific weight range, is now under forces it cannot distribute safely. Joints don't just ache, they deform. The architecture of your ankles, knees, and hips begins to change shape under chronic overload, and many patients at this stage require joint replacement surgeries, if they're even medically stable enough to survive the operation. The heart at extreme obesity is working harder than a healthy heart runs at peak exercise, but it's doing this continuously, 24 hours a day, 7 days a week, with no recovery window. It compensates by growing thicker walls, a condition called hypertrophic cardiomyopathy. But a thicker heart muscle is also a stiffer one. It pumps less efficiently. Heart failure becomes not just a risk, but a statistical expectation in long-term cases. Breathing becomes a crisis. A condition called obesity hypoventilation syndrome, also known as Pickwickian syndrome, means the body can no longer move enough air in and out to keep blood oxygen and carbon dioxide balanced. Carbon dioxide builds up in the blood. The brain, sensing this, triggers a chronic state of low-level respiratory distress. People report feeling short of breath, even lying still, even at rest. Mobility at this level often approaches zero. Getting out of bed without assistance becomes impossible. Bathing, using the bathroom, turning over, all require help. The social isolation that follows has documented psychological consequences. Depression, anxiety, and cognitive decline accelerate, and each of these creates its own feedback loop, driving further inactivity and further weight gain. And the skin, it's essentially failing as an organ at this stage. Pressure ulcers form wherever the body contacts surfaces for too long. Infections that would be minor in a healthy person become life-threatening, because circulation to the extremities is so compromised that immune cells and antibiotics alike struggle to reach the wound. But here's the question you're probably asking yourself right now. Is there a point where the body just stops? An actual maximum? That's what we're building toward. Stay with me. Beyond extreme obesity, and yes, this territory exists, we're talking about individuals who have reached 300, 400, 500, even over 600 pounds. These are not numbers pulled from fiction. John Brower Minnick of the United States reached an estimated weight of over 1,400 pounds at his heaviest, making him the heaviest person ever recorded in medical history. Manuel Uribe of Mexico reached over 1,300 pounds before medical intervention helped him lose a significant portion of that weight. Both cases reveal something profound about human physiology. The body does not reach a number and suddenly stop. It keeps going. It adapts and compensates and struggles forward until one system fails completely, and that failure cascades into others. At weights this extreme, the skeleton is no longer functional in any meaningful sense. Bones fracture under static load. Muscle tissue, despite being present, cannot generate enough force to move the mass it's attached to. These individuals are bedridden, not by choice, but by physics. The cardiovascular system operates in a state of continuous crisis. Cardiologists describe it as asking a car engine to run at redline RPM indefinitely. every organ that depends on adequate blood.
Kidney failure, liver failure, and respiratory failure are the most common causes of death in this population, and they often arrive simultaneously. The medical care required is extraordinary in its complexity. Standard hospital equipment, beds, imaging machines, surgical tables, blood pressure cuffs, is designed for bodies up to roughly 350 to 400 pounds. Beyond that, specialized facilities are required. Simple diagnostic procedures become logistically impossible. A CT scan, for instance, requires fitting inside a machine with a fixed bore diameter, and at extreme weights, this simply cannot happen. Wound care becomes a full-time medical operation. Pressure ulcers at this stage can reach the bone, a condition called osteomyelitis, where the bone itself becomes infected, and the treatment is surgical removal of infected tissue that may never fully heal. So let's answer the question we've been circling. Is there a maximum weight the human body can survive? Medically, there is no specific number, no single pound that kills a person. What kills is the accumulation of system failures, respiratory collapse, cardiac arrest, sepsis from infected wounds, stroke, pulmonary embolism. The body doesn't reach a weight and flip a switch. It degrades system by system until something catastrophic gives out. But here's what the science does tell us clearly. Every single stage of this progression is partially reversible, especially in the earlier phases. Losing as little as 5 to 10% of body weight, even in moderate obesity, significantly reduces blood pressure, improves insulin sensitivity, reduces joint stress, and lowers cardiovascular risk. The body wants to recover. It's built with incredible resilience.
But that resilience is not infinite. And the later you intervene, the more irreversible the damage becomes. Cartilage doesn't regenerate. Scar tissue in the heart doesn't disappear. Nerve damage from years of poorly controlled diabetes is largely permanent. There are real biological cliffs, and once you've gone over them, you're managing consequences, not undoing causes. The science on this is unambiguous. Early intervention saves lives, extends healthy years, and preserves mobility and independence. Bariatric surgery, GLP-1 receptor agonists, structured behavioral programs, these aren't cosmetic tools. They're medical treatments for a medical disease, and they work best the earlier they're applied. The question was never really how much weight a human body can hold before it breaks. The real question, the one that actually matters, is this. At what point do you decide that the life you're living right now is the one you want to protect? Because everything we just walked through, from those first quiet inflammatory signals to the catastrophic cascade of extreme obesity, it all follows a timeline, and that timeline is not fixed. It can be interrupted. It has been interrupted millions of times by people who decided the bridge was worth reinforcing before it fell. The limit of the human body isn't written on a scale. It's written in the decisions made before the damage becomes permanent. If this video made you think, share it with someone who needs to hear it, and subscribe to the Mystery of Science, because we're just getting started.